Some help for parents supporting the mental health of children. Welcome back to Techstination. I'm Fred Fishkin. Joining us is youth mental health expert and dean of the NYU Silver School of Social Work, Dr. Michael Lindsey. Hi, Dr. Lindsey.
Hi, good morning, and thank you for having me.
A pleasure to meet you. Now, there is some new data from Mental Health America that sounds somewhat encouraging when it comes to youth mental health. Still challenges, of course. Give us the overview.
Yes, Fred. Young people need our support like never before. According to new research from Mental Health America among 12 to 17-year-olds, roughly one in six, or about 15%, experienced a major depressive episode in the last year, and one in 10, or 10%, reported serious thoughts of suicide. But there's good news. According to a study from Sergo's Youth Mental Health Tracker, 67% of youth found talking to a family member to be helpful for their mental health and well-being. That's why it's so important for parents and caregivers to open up ongoing and supportive conversations with the kids in their lives, conversations where we really listen to understand.
Are the numbers of kids in crisis, or are they holding steady or hopefully decreasing at all?
Well, the unfortunate news there, Fred, is that the numbers are actually increasing in terms of the number of youth who are reporting depression, anxiety, and suicide rates have gone up. I think that the pandemic certainly laid bare just how vulnerable the emotional and psychological well-being of youth in our country are, right? And so I think that we have seen the increases in all those dimensions I just mentioned um, with respect to the sort of aftermath or returning to quote unquote a sense of normalcy. So unfortunately, the rates are continuing to increase.
A lot of parents wonder why. You have a new podcast from the Sound It Out campaign. Tell us about it.
Yeah, so just about the Sound It Out campaign, it's a national campaign from the Ad Council and Pivotal that helps parents and caregivers support the emotional well-being of their adolescent children. The campaign offers free, expert vetted tools and resources to help open up productive conversations and move beyond the I'm fine responses that children often give us. It includes the new listening podcast available wherever you get your podcasts. PSAs for the campaign are airing nationwide, and parents and caregivers can visit the campaign's website at SoundItOutTogether.org or Instagram to find tips and resources.
And the podcast, again, is called Listen In. So, what are some warning signs that maybe parents, grandparents, and others should be aware of that can indicate that a child is struggling?
This is a really, really great question. Thank you for asking. Kids often cope in ways that bring relief or do no harm, but it can be concerning if they're coping in ways that are or can become destructive. Some signs that a child may be struggling are a sudden change in behavior, sleep schedule, appetite, or appearance. I often like to say it doesn't have to be rocket science. Parents or caregivers only have to notice a change, a difference in how their child is behaving, or as I mentioned, sleep schedule, appetite, or appearance. But I do want to mention that if you're concerned about your child, you can find free expert vetted resources at sounditouttogether.org. I also want to say you're also not alone in this. You can also reach out to your child's school counselor or trusted relatives and friends who often are on the front lines, like caregivers and parents are, and will notice the changes in the child's behavior or the other matters of the child's well-being that I spoke of earlier.
For a lot of parents, I think a big hurdle is how to break the ice, how to start this conversation about what they're noticing.
Yeah, no, it's important to have open and honest conversations with your kids at any age. But the adolescent years of middle school and high school are an especially important time in a child's personal and social development. Kids this age are often shifting their primary focus away from their family toward their peers. They're exploring new interests and friendships and experiencing new social and academic pressures. And so, uh, developing that trusted, supported relationship with them where they feel that love and support is so important. And one of the ways that that can happen is really sort of honing in on having your child express their feelings, how they're feeling in terms of the things that they're going through in their lives, so that they're able to label those feelings with the circumstances of their lives and give you the opportunity as the caregiver or parent to support them in the ways that they need to. We want to move away from the closed-ended responses that children may give us, like yes, no, particularly with questions like, how are you doing? And moving to more questions like, how are you feeling? So that we can label those feelings and really get our children to express what's going on in ways that give us the opportunity to fully support them.
Really important. And if you're enjoying this, for more, listen in is the name of the podcast. Head to sounditouttogether.org/podcast. Dr. Michael Lindsey, thank you so much for spending time with us.
Thank you, Fred, for having me. I appreciate the opportunity.